Hello there and you're very welcome to Prime Time. Well, the government is warning that it is close to having to reimpose a national lockdown, but both deaths and hospitalisations remain very low. So is another full lockdown likely and would it be justified? That's what we'll be discussing in a moment, but first, Conor McNamara has been looking at the facts.
On March 27th, the day Ireland went into lockdown, the daily number of cases was 302. The daily number of cases peaked at 936 on April 23rd, and today there are 93 cases. The number of confirmed cases in ICU peaked on April 11th at 155. Today there are 5 patients in ICU. The number of cases in hospital peaked at 881 on April 15th. Today the figure stands at 29. The total number of confirmed cases up to today is 28,453. With 77 deaths, April 20th marked the highest number of COVID-19 fatalities in a single day. 2 people have died with the virus in the last 7 days, with a total of 1,777 deaths to date.
We're at a tipping point. We could be looking at another national lockdown. We have to take this deadly seriously.
That report compiled by Conor McNamara. I'm now joined in studio by Michael McNamara, TD. You're also Chair, Michael, of the Oireachtas COVID Committee. And from Cork, by Professor Jerry Killeen from University College Cork. Welcome to you both. To you first, Professor Killeen, do you think, as the government mentioned there, that we could be close to another national lockdown?
Well, sooner or later, that will be inevitable. That has always been on the cards since we signed up to a suppression and living with the virus strategy. So there will be another. I think the term lockdown is a bit extreme because it's normally a kind of a civil order intervention, a law and order intervention. But certainly the restrictions we saw in phase 1 and phase 2, those will have to be reintroduced again. And the question is, do we take them to an exit strategy, or do we get into a roller coaster of lockdowns and relaxations, restrictions and relaxations, which could go on for 4 years or more? Okay,
Mike McNamara, you're chair of the Oireachtas Committee. Listening to Professor Killeen, do you think we could be looking at a national lockdown?
Well, I mean, I can only give a personal opinion.
Yeah.
Ireland, like practically every other country in the Western world, is seeing an increase in detected cases. But thankfully, up to now, that increase in detected cases has not been accompanied by an increase in hospitalisations, nor has it been accompanied by an increase in the numbers in ICUs, nor the numbers dying, thankfully. As I say, Spain, for example, which went through a horrendous crisis earlier this year, is also going through a huge increase in detected cases. And the Spanish Prime Minister characterised their response as one of caution and serenity. Caution because of the increase in cases, but serenity because that is not resulting in a situation like they had in March. It's not resulting in an increase in hospitalisations. And I think, while of course we need to be cautious, very cautious, we also need maybe to be slightly more serene, because this talk of lockdown is having a huge effect, not just in the economy, and I know there are others here who'll talk about that later, but also on our psyche and on the mental health of people. And, there's only so much that society can bear. Now, the other thing about a lockdown is, well, what do we do after we've locked down? If we manage to get to zero, well, what do we do then? Because we're not like New Zealand. New Zealand's nearest neighbour, New Zealand is a far less densely populated country. Its nearest neighbour is over 1,000 miles away, less densely populated again. We're a much more densely populated country. We're right beside the United Kingdom, which is more densely populated. And we're part of the European Union, which is only a couple of miles from the southeast coast of the United Kingdom. So, what can we achieve even if we get to zero, even if it's possible to get to zero? And I note a lot of academics. There was a Harvard professor on Primetime this night, I think last week, who said that he didn't believe it could be eliminated. But even if it can, then what do we do?
Jerry, come in on that.
Sure. Well, elimination is a standard play in the public health textbook. It happens all the time. It happens to Ebola outbreaks. It happens to cholera outbreaks. SARS wasn't just eliminated, it was eradicated. It is possible. It's a matter of political will. And that's the challenging part with this virus, is because of the distribution of risk, it divides society. And while we are all debating, the virus marches on. It doesn't waste time on debates, and it has a single agenda.
But actually, as Michael Sorry, Jerry, as Michael McNamara mentioned there at the beginning of when he was speaking, I mean, obviously one death is horrendous for the family involved, but deaths have not escalated in the way you would expect for the rise in cases. And that includes countries like Spain, France and Italy too. So do we really need to lock down?
Well, our second wave is going to be different in character to the first. What we're going to see is a slower onset. And what we're also going to see is a slower transfer to the vulnerable populations because they're better protected than they were. So this time around, our sandcastle is taller and the tide is coming in slower, but it is coming in. And, you know, it's a matter of time. Now, what really worries me about this second wave is that by the time we see fatalities reach the same kind of highs that we've seen before, you know, by the time we find ourselves into the American experience of the second wave, then we've allowed our reservoir of infection amongst younger, less vulnerable people to grow into a really, really big problem that's going to take an awfully long time to shrink down, you know, back to size and then get back to the business of getting rid of it.
Well, I note Dr. Killeen's prediction. I mean, we have, and I have heard from a number of academics who are a lot less willing to predict the future, including experts on epidemiologists and including this director of the Centre for Evidence-Based Medicine at Oxford University, who is sort of very loath to predict the future because this is a new virus. We knew almost nothing about it when we were, to the extent that we advised nursing homes, or not the state advised nursing homes, to take away the restrictions. Private nursing homes had put in place restrictions on visitors. They were told that wasn't necessary. There were predictions that this wouldn't affect us at all. We unfortunately know that wasn't the case. But I think there's a lot more that we don't know about this. And I think there are many experts who will talk more about what we don't know than what we do. So I do note Dr. Killeen's predictions. I think we both hope that they don't come true. But I do also accept there are a lot of doctors and a lot of academics who are far less stark in their predictions.
And also, you know, Jerry Killeen, I think people watching tonight and they hear you, but they might be very worried and depressed at the thought of us coming into this terrible second wave. I mean, also, don't we have to balance society, Jerry, between the mental well-being of people, you know, society continuing to function at the same time as protecting the vulnerable? Doesn't that balance have to be struck?
Well, I wish it could be. And in other fields with other diseases, with other dynamics, that's actually the side of the table that I sit on. But when you have something that has a base reproductive number of 4 on average and has asymptomatic transmission, that puts it in a totally different category to anything we've ever dealt with before. So I wish there was a middle way, but unfortunately there isn't. You know, this is a virus for which the dynamics are just too dynamic, and unfortunately it's very predictable. It follows all the basic models we've had since the 1980s. Okay. And the evidence is stark. The problem is that it's difficult. It's really difficult evidence to absorb, accept and act on.
Okay, a sentence, Michael, from you.
Well, simply that it hasn't followed the predictions up to now. We haven't seen the increase. It may be that we will have to lock down. I personally desperately hope that we don't, for the effect it'll have on our economy. And ultimately, we need, as the CEO of the HSE has said, we need an economy that can fund our healthcare system. I'm worried that we won't be able to afford the healthcare system we had, much less the one we need. It hasn't followed the predictions up to now. We haven't seen the increase in hospitalisations, and thankfully we haven't seen the increases in deaths. And I certainly hope that will continue.
Michael McNamara, thank you so much. Professor Jerry Killeen, thank you too. David.